Nursing school is ending! Yay! I'm so psyched.
So finally, I got some meds. Garlic, ginger tea, big bag of vitamin C. I'm gonna juice these with the juicer, mince and cut up the garlic, and honey. Hi guys, thank you for watching. Today is December 11th and it's actually my birthday. But I'm studying on my birthday because tomorrow is the last day of class and it's my final. So I'm actually okay with studying on my birthday, you know?
I'm getting my life back and I'm getting my freedom back after tomorrow. And halfway because I still have to take my NCLEX.
But it hasn't hit me that it's my birthday. It hasn't hit me that tomorrow's the last day of nursing school. And,
but I'll take it.
Sorry you guys have not seen me or heard from me in a while. It's just been so hard to pick up the camera in the midst of everything that I have going on. I am trying to just, finish studying. I've been studying sparingly, here and there a little every day for maybe the past 2 weeks now. So today I've been kind of lazy and just not I haven't really studied today yet. I'm gonna get into it now, but I'm just really trying to focus on things that I feel like I don't remember. Oh, one of the biggest things that I will be going over today are meds. Tons of meds, to know the side effects and to know, like implications.
By the way, the attire that I have on right now, it is not in any shape this type of weather. I'm in the garage and I just grabbed this out of my closet. So if you guys think, I'm in New York, y'all, I'm not.
Deliberate deception intended to produce unlawful gains. I don't know, I don't see the PowerPoint anymore. Individuals at least 18 may indicate they wish to become a donor on his or her driver's license. An individual who is at least 18 years old. So I'm about to start questions on my test topics. So from my NCLEX book comes a code and you get the online portion where they have tons and tons of questions on here that I have done for every test. This is not sponsored, by the way. So the website is evolve.elsevier.com. And we log in and everything like that. You'll log in and I come over here and to course content and it is, which one is it? Click exam review. After clicking exam review, it brings us to this screen and it just tells us this program offers several ways to prepare for passing nursing school and the NCLEX. You have assessment mode where it consists of 75 specific questions and generates a study calendar. You have study mode. It generates all questions from categories and subcategories you choose. And you get instant feedback, which I love because I need to know why it's right. I need to learn the rationale so that I can on tests think about the rationales as well, including the correct answer, rationale, a test-taking strategy, codes and references. It also has exam mode and then the history section and auto reviews. Okay, how do I go past this? Okay, continue. And then you just have to fill in your login. I always go over to study mode and then I choose content area, right? And then I have all these subcategories: adult health, adult health, child health, critical care, developmental stages, fundamental skills, leadership management, maternity, mental health, and pharmacology. And so for instance, we go to adult health, click on that, and I have all cardiovascular, hematological, immune, integumentary, oncology, renal, and urinary, all of these. So for my test topics, here are some of them. I want to, go over some of these. So I can do that. So I'm going to start on ones that I feel like maybe I should start on first. And I want to do my vents, trach care and suctioning, as well as vents are COPD. So I'm going to come back over. And go to respiratory. And then it'll tell you how many questions there are. If I scroll down here, it has 182 questions among respiratory. Now the thing about it is I'm gonna have to skip through questions because it's mixed in with there's many questions on respiratory. So I just want to hit my COPD, my ventilators, my trachs, my endotracheal tubes, and things on my test. So I found my first respiratory question to show you guys. Now, there are trachs on my test, so this is a trach question. While changing the tapes on a tracheostomy tube, the client coughs and the tube is dislodged. Which is the initial action? So here we go. We have our answers. 1, call the healthcare provider to reinsert the tube. 2, grasp the retention sutures to spread the opening. 3, call the respiratory therapy department to reinsert the trach. Or 4, cover the tracheostomy site with a sterile dressing to prevent infection. Think about how this tube is keeping their airway patent. Now, if the tube dislodges, their airway is no longer patent. So, think about it. If the tube is dislodged accidentally, the initial nursing action is to grab the retention sutures and spread the opening. If agency policy permits, the nurse then attempts immediately to replace the tube. Calling ancillary services or the HCP will delay treatment in the emergency situation, and covering the trach site will block the airway. The nurse is caring for a client immediately after removal of the endotracheal tube. The nurse should report which sign immediately if experienced by the client. 1, stridor. 2, occasional pink tinge sputum. 3, a respiratory rate of 24 breaths per minute. Or 4, a few basilar alarm crackles on the right. Well, if you know what stridor is an obstruction of the airway. It sounds like a snoring noise, and it is an obstruction. There's something blocking the throat. So that's the noise that you would get in the airway. That is the problem. That is what you immediately should report. Airway, breathing, and circulation, your ABCs. Always think about that. So following removal of the endotracheal tube, the nurse monitors the client for respiratory distress. The nurse reports stridor to the healthcare provider immediately. This is a high-pitched, coarse sound that is heard with the stethoscope over the trachea. Stridor indicates airway edema and places the client at risk for airway obstruction. Although the findings identified in the remaining options require monitoring, they do not require immediate notification of the healthcare provider. The nurse is preparing a list of home care instructions for a client who has been hospitalized and treated for TB. Which instructions should the nurse include on the list? Select all that apply. 1, avoid contact with other individuals except family members for at least 6 months. Once you start medication therapy, within 2 to 3 weeks of medication therapy, you are no longer contagious to anybody. So avoiding contact with other people for at least 6 months is not true. A sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. Yes, every 2 to 4 weeks you'll be needing a sputum culture, and you are negative for tuberculosis once you have 3 negative sputum cultures. Respiratory isolation is not necessary because family members already have been exposed. That is true. You do not need to have respiratory isolation for family members. What needs to happen, though, is your family members or anyone that you have been around, family, friends, they need to be tested for TB. They need to get a TB test. They need, you know, if the TB test is positive, then they will further go on with needing sputum cultures. Number 5, cover the mouth and nose when coughing or sneezing and put used tissues in plastic bags. Please do us all a favor and cover your mouth and nose when coughing or sneezing. I would appreciate it. When one sputum culture is negative, the client is no longer considered infectious and usually can return to former employment. That is not true. When 3 sputum cultures are negative, then the client is no longer considered infectious and usually can return to their former employment. So it's 5:29 and I just completed the 100 and what was it? 80 something questions for respiratory, and I've completed topics like on my test, trach and suctioning, endotracheal tube, COPD, TB, vents, and ARDS. So now I'm about to actually cover, let's see, I want to cover CHF. The nurse is performing an assessment on a client with a diagnosis of left-sided heart failure, which assessment component would elicit specific information regarding the client's left-sided heart function. 1, listening to lung sounds. 2, monitoring for organomegaly. 3, assessing for JVD. Or 4, assessing for peripheral and sacral edema. Well, first of all, in order to answer this question, you need to know the differences between left-sided heart failure and right-sided heart failure. So because I know the differences and because I know left-sided heart failure causes backup of blood into the lungs, and it can cause dyspnea, and it can cause low cardiac output, and therefore, you know, hypoxia, etc., I would listen to lung sounds because of that backup into my lungs. Not my lungs, guys, but... The client with heart failure may present with different symptoms, depending on whether the right or left side of the heart is failing. Peripheral and sacral edema, JVD, or organomegaly are all manifestations of problems with right-sided heart function. Lung sounds constitute an accurate indicator of left-sided heart function. Okay, so I'm on sickle cell, guys. The nurse is preparing a plan of care for a client with sickle cell crisis who will be admitted to the nursing unit. The nurse should include which intervention as a priority in the plan of care for the client. I already picked the answer, but the answer is initiate an IV line for the administration of fluids. That's number 1 with a person with sickle cell who is in sickle cell crisis, specifically vaso-occlusive crisis. The priorities in management of sickle cell crisis are hydration, therapy, and pain relief. To achieve this, the client is given IV fluids to promote hydration and reverse the agglutination. Why does that always happen to me? Jeez. Oh my God. Okay. Where was I? And reverse the agglutination of sickled cells in small blood vessels. Opioid analgesics may be given to relieve the pain that accompanies the crisis. So I started this program last year, January 20th, 2015, and, you know, never did I imagine seeing the end. And that doesn't mean that I didn't think I was going to pass or anything like that. What I'm trying to say is when you know you're about to go on such a journey, such a busy, rigorous, you know, difficult at times journey, you don't see the light. I have not seen the light. I have not seen an end to this. I couldn't ever imagine an end. It seems so far away. Well, now I'm 23 and I'm finally graduating, you know, after 2 years. I just want to share with you guys and let you guys know that wherever you are in your journey in life, keep at it. You know, my journey was never easy. Nursing school is not easy. I don't care who you are and what kind of grades you had or have. It's definitely a life changer. It affects a human being emotionally, mentally, physically. And you have to be strong-willed and know what you want out of this nursing thing or you're not going to survive. I just want to say keep at it, keep working hard, keep being determined, keep focusing on your growth and your needs and wants out of this. Hashtag study breaks be like. This is a gyro from Arby's. Roast beef. It has like tomato and lettuce and mayo and onion in it. And I'm about to crash on the couch. Today is the last day. Oh my god, I'm like bursting at the seams right now. Like today's the last day of nursing school. Like what the heck? Man, it's gonna be a day for me. It's gonna be a day for me right here. Just wow, not okay. That wasn't supposed to happen. But today's the last day. I'm gonna go and take my final. I was up until what time? 5 studying. I got 2 hours, maybe 2.5, 2 hours and 45 minutes total, but not together. I did like an hour and a half of sleep around 11 o'clock, and then around 4 o'clock, 5 o'clock, I slept for another hour. Woo! So I am just ready to get this over with. Here's my big pile of crap. Well, not big. I just used, you know, my NCLEX Saunders and my questions, and then I made a whole list of all the meds that are going to be on this test. Like, for instance, HIV and TB and like Parkinson's disease, the levodopa, and like facts that I need to know about it, the ADHD, you know, CNS stimulants, you know, to take it with any over-the-counter meds, or, you know, it causes hunger suppression. You don't get hungry, so you have to monitor their weights, their growth, you know, my stroke and my Alzheimer's and spinal cord injury has the most. RA, SLE. Sorry they're messy. I just want to show you guys how I focused on meds this test, because you never know. I'm about to head out. I did dress a little bit more better today. Supposedly we're getting together, my classmates, and we're going to, you know, get a bite to eat after. So I kind of dressed a little picture worthy today. Okay guys, see you later.
You're stressed, okay?
It wasn't hard. What are you drinking? At the same time it was like simple but really hard.
Everybody get water.
Thank you.
Stay hydrated while you
Oh yeah.
He knows we're gonna need it.
Yeah. You don't know what we've been through.
It's in the blood first. I'm gonna get some other human sample.
Just grab what you can. Don't even waste time on it.
Everybody stuffing their faces and whatnot. Yeah, so I just showed you guys a snapshot of my Snapchat from yesterday after I got my grade for my final, that I successfully passed. And it was around 10 o'clock last night when my teacher posted my final grade. So that's when I posted that on Snapchat. Hella happy, hella excited. So I thought I'd share that with you guys.